Hi, hello. Welcome to another episode of Manta Care's Patient from Hell podcast club. My name is Mike Lin. I'm a patient advocate here at Manta, and I will be your host today. Today's episode is funded by the Patient-Centered Outcome Research Institute, or PCORI. The goal of this collaboration is to bring doctors or researchers onto the Patient from Hell podcast to share about their research so more of us can learn about it and use it to help us in our lives as patients or care partners. The podcast club then gives us the opportunity to chat with members of our community and to get their perspective on an episode. Maybe to put it more simply, this is where theory gets put into practice for cancer patients and their loved ones as we gain more knowledge about updated standards of care and how we want to operate as patients and advocates in the world of cancer. Today, my guest is Stephanie Walker, a metastatic breast cancer thriver and advocate. And Stephanie, I'm really excited to hear your story and your thoughts on the podcast episode. So let's start with your personal background in the cancer and advocacy space, and then we'll move our thoughts onto the discussion between Samira and Dr. Nemecek. Stephanie?
Absolutely. Thank you for inviting me. My story began, I can say, almost 10 years ago with a diagnosis of stage 4 metastatic breast cancer de novo. In my professional life, I was a nurse. I guess once a nurse, always a nurse, but a non-practicing nurse now, thank you to cancer. As far as the patient advocate part, I did not know about the metastatic breast cancer world until 3 years after my diagnosis. And that's when we had relocated to another state. I had taken a new job. I loved my job. I was an on-call hospice nurse. So I dealt with the end of life for the last 14, 15 years of my nursing career. And I unfortunately developed some side effects of my chemo ongoing, actually, of a pulmonary embolus, and then I had a stroke. So with that being said, I couldn't work anymore. So I had to find other means to, provide food, clothing, and shelter, and keep my house. So that's when I started getting online, looking for places and seeing that this whole world existed for not just cancer patients, but specifically subsets such as metastatic breast cancer. So I attended my first conference for all metastatic breast cancer in April of 2018. So after that, it's been full force into advocating for, especially when I seen that there was where I live now, which is considered a rural community, such high numbers of deaths related to breast cancer. And I couldn't figure, I still don't know the reason why, other than obviously it's a very underrepresented population of people that I live in, rural immigrants, migrants here doing farm work, that kind of thing as well. So I'm all about trying to educate Black and brown women, people of color, about breast health.
That's a lot, and I'm sorry to hear what you've been through, but I'm happy to hear what you've turned it into. It's pretty crazy how when we get into the world of cancer, whether it's via someone we know that's close to us or ourselves, in our cases, you start to see it more and more. It's something that if you weren't, you were a nurse, so maybe I'm misappropriating what has happened to me, but I was not in medicine prior to my diagnosis. And as soon as I got into my first treatment or out of it, everywhere I looked, I saw the need for help and, needing to address the mental health concerns or the physical health concerns, or like you said, you have underserved communities. It becomes like oh my God, I know this world and I need to do something about it.
That is true. Unfortunately, cancer graced my doorstep really early in life. I had a sibling that had ALL, as a form of leukemia.
Yeah.
And he was diagnosed at the age of 3, passed away at the age of 13. Oh. So, that's where I said, I want to be a nurse. And then from there on, just doing pediatrics, I've been the nurse that's in the ICU that administers chemo to patients, or, on the pediatric floor of giving chemotherapy agents to really young patients. And, and at that time, I think not questioning God, but kind of questioning God, saying, what have these kids done? in their short lives, under the age of 10 to have this diagnosis. And to be honest, that's how I pulled strength in my early diagnosis of metastatic breast cancer, was remembering the stories and remember these kids that, I took care of. Their hair would fall out. You get them up in the morning, their hair's laying on the pillow, they're still sitting up. They throw up in a bucket, then they hug their IV pole, and we go to the playroom, and there we go. And I think to myself, if they can do that, this old chick can do that too. Sneak her up, Steph. It's going to be a good one. So that's, absolutely.
Well, I mean, an incredible amount of respect to you for the work you've done there. And yeah, I mean, coming from the background you described with your sibling too, I mean, I can see how you got there. And it's a good segue, because today we're reacting to the Patient from Hell podcast. And the episode is 76, which features the founder of Manta Cares, Samira Daswani, and Dr. Eneida Nemecek. And Dr. Nemecek is also in PEDS. And if you haven't watched the episode and you're watching this right now, I highly recommend you do so. But it's basically about Dr. Nemecek's work as a pediatric oncologist and the science behind the treatment she works with, and kind of the zigzag path that took her to oncology, including extensive family history. And like you said, I mean, you had this all throughout your life. I mean, my father is a multiple time cancer survivor at this point too, not to the same degree. I wasn't as immersed in it as you were before getting into the advocacy space, but it's this strong calling, especially if you have these experiences. And you talked a lot about understanding what it's like, and a little bit of questioning, how we all get here. But when you are so overexposed to it, it lets you see a side of, I guess that's how empathy works. It lets you understand better than people who haven't been exposed to cancer. So when we're talking about this episode, the first thing that I wanted to bring up is Dr. Nemecek and Samira by extension, and now you and I as we sit here. We probably all understand how important it is to have good, empathetic providers. You actually, your intro or your description of your background in medicine is perfect. Can you tell me how you feel about, what the quality of a provider means from a humanistic standpoint?
Oh my gosh, the qualities of a provider. It is very important to me. It really is important to me that not only the provider, but his staff, to appreciate what they're doing for other people. This is a really bad time in our lives, and we need people to be empathetic. Don't shame me. Don't pity me. Just understand me. And, I fired the first doctor out of the gate. So, I don't care. And it was all because of his staff. You could have you could be the best doctor in the world to treat XYZ disease. But if you have a shitty office staff and a non-caring, condescending staff, I'm out. Because
Absolutely.
I'm going to have to deal with that staff more than I'm going to have to deal with you.
Yeah, I mean, you said don't pity me, don't condescend me. I mean, the thing that I would always say to, anyone who I dealt with, whether it's at a clinic or in my personal life, and maybe even more so in my personal life, I would say, don't kid gloves me. Like, this is a human experience. Like, granted, it might be a little foreign for me and a little foreign for you, but like, people get cancer, and not all of us are, on our deathbed at this point in time. There's a broad range of how cancer affects people. And I need you to talk with me as though this is accessible, as though we can have conversations about what it's really like.
You don't realize how many friends that you don't really have. You think you have, but you don't have, until a diagnosis like this. And, I've had friends from way back when. I have a really good friend that I've been friends with for most of my life. They actually used to beat me up and take my lunch money. But now she's one of my favorite people, But
funny how that happens.
Yeah, we have people in our life that when the rubber hits the road, they're gone. They don't. But is it because they fear it, or they don't understand it, or they just truly don't know what to say? You know what I mean? Because I hate those people that come up to me and says, "Wow, you look good to have cancer," or
Mm-hmm.
that's.
I've I'm 37. I've had cancer since I'm 30. I'm still an active athlete. And people would go, "You don't look like you have cancer." And I'd be like, "Cool. Thank
What,
you."
what does it look like, really?
Yeah, right. Exactly. And so you're doing a great job of leading me right into the next questions I want to ask. We're talking about who is there for you, and a lot of the episode was about caregiver and caregiver quality of life. But let's start first with, I mean, who has been a caregiver in your world, because you've played that role so often. I mean, who are the people that have really been there for you?
Yeah, and a lot of people have been, and I have tried to always, and I still to this day want to make sure that you're okay with me being sick. You know what I mean? It's like, oh, I don't want to lay too much on you because you can't handle it. But the fortunate situation in my home is that my husband and I, it's just the two of us, both fit the same role: a cancer patient and a caregiver. He's had head and neck cancer, and then here most recently prostate cancer. So he's been the caregiver for me. I've been the caregiver for him. He's been a patient. I've been a patient. We just do the shit together and we get through it. Um, my adult children have been, present, good but not good. The daughter is a nurse. She handles more of the details. The son is, I want the surface level stuff. Don't make me cry because I'm a major in the Army, and that didn't happen. So, and I have friends. I've had friends from the beginning, of this process that have been there, understand the goods and bad. It took me a long time, to be honest, with my team, Stephanie, because I felt like I couldn't bring to them the bad parts. I could only bring to them, I'm doing good, I'm plugging along, yay me. But it did cause issues, mental health issues, a little bit further down the road. So,
Yeah, I mean, I know exactly what you're talking about. During my first diagnosis and treatment, I couldn't tell what my role was supposed to be as a patient. I was doing relatively well in treatment, and at least physically. And so I would, give people that update. I would say, "Hey, I'm doing great," but in reality, I was crumbling mentally, and not being able to tell people that, it eventually took a toll on myself and my partner and everyone who was closest to me. And I realized that, like, you need people who you can give the real version to. You need people who you can look at and say, this is going terribly.
this
And
shit's hard, man, ain't it?
it's so hard. And reciprocally, then when you find those people, this is another thing I found out, is when you find those people, they end up taking on a lot of the burden. You can't be a good caretaker and not care. You can't be a good caretaker and see someone going through what cancer patients are going through and not stress about it and not lose sleep about it. And specifically, I'm bringing up lose sleep because that was part of Dr. Nemecek's studies. She was trying to make sure that, caregiver quality of sleep was something that is studied, and we're looking at all the metrics of a whole life picture. So let's use you and your husband as an example, which I know, I mean, one, it's weird because it's so rough to hear that story of two patients simultaneously, essentially, or even if it's intermittent, but you guys intimately know that world better. Having someone who has been through it at least allows him, I'm assuming, to have more empathy for you and you for him. But man, you don't want to get it that way. It's like you wouldn't sign up to be
Exactly.
empathetic like this.
Exactly. We're supposed to be husband and wife. This shit ain't supposed to happen. But anyway, it does. And, John has always, since we've been married almost 25 years,
That's awesome.
he has always desired, gotten more sleep than I have. And that goes back to the nursing days of working rotating shifts, and then as a flight nurse, being up, 24 hours a day, and all this bullshit. So I required little sleep and could function, but getting little sleep going through cancer treatment, that could kill you.
Yeah.
That will put you in a hospital for dehydration. Da, da, da. My only hospitalization was due to poor care of myself, not eating and drinking. And my husband told my doctor on me, and sure enough, dehydrated as hell. But we do have to take care of ourselves. It's taken me a long time to get to that point. But, more recently in 2023, when my husband was struggling, and he was in the hospital, I finally had to give myself permission not to sit at the hospital all night.
Yeah.
Go home. Go home. I'm not the nurse here. I'm the wife. I need to go home.
Well, especially because when you're in that role as the wife or the caregiver, or just as an individual, you need to take care of yourself so that you can, one, help the person as a caretaker, but two, I mean, you're a caretaker and a patient simultaneously. And this is something that I try and make sure I do, or emphasize to people who ask me questions about, hey, how do you deal with cancer? What's the best thing you can do in treatment? And my answer is usually try and take care of the things that you control, which includes how well you sleep or what you put into your body, what you eat,
That
if
is
you
all you
want
can
to
control.
exercise. And it's a tough task, because when people, everything's easy on paper. People can write down a diet for you and a sleep plan, an exercise plan, and at some point you're like, shit, I'm doing chemo, I'm doing immunotherapy, I'm doing, this is crushing my will. And in order to do that, you have to remind yourself that, like, nobody was perfect prior to being a cancer patient. So when you're trying to put your best foot forward in terms of taking care of yourself, you need to have some grace too, because otherwise you're going to stress yourself out more.
Absolutely. Absolutely. And the diet part, people ask me all the time, oh my God, what diet did you change? What did you do different? And I said, oh, hell no. Now I'll even go for dessert first. I
Yeah.
mean, I'm just saying, but I didn't change much. Why change now?
Oh,
I
you got to
already
enjoy
have
what
the
you're doing.
disease. So, I mean, what difference does it make now? I have a friend that always says when we have lunch, well, we used to have lunch together. When we lived in close to the New Orleans area, oh my God, you're going to use an artificial sweetener? You know that stuff causes cancer.
One, I got it. Yeah. And two, I mean, I laugh at this so much. I mean, we don't have time in this podcast for me to go on my little tangent about the sugar police and the people who talk about, what contributes to it. It's like most cancer that we run into these days, as far as I know, I'm not a medical professional or researcher, but I've been told by pretty reputable sources that it's a lot of genetics, it's a lot of luck. I mean, I'm a, competitive athlete my entire life. My life has been centered around, eating well and working out. I didn't go out in the sun a lot, and all of a sudden I'm a stage 4 melanoma patient. So I'm guessing it's not the food I ate. Stuff like that
Yeah.
is when people will tell you, coming from a place of relative ignorance, they'll throw out things they've heard on the internet, and it's just like, let me be, let me.
Yeah, exactly.
Yeah.
It's like cancer, sugar causes cancer. It's like, well, no, it causes you to
Right.
be fat, and that's pretty predisposition of cancer, as well as heart disease, diabetes, and a whole bunch of other things. So yeah, you're
Yeah.
right. I just kind of like smile and nod my head all the time as I'm thinking you're so stupid. Just
You learn how to do that pretty well. The
You
smile
do,
and
you do,
nod.
you do. Just how to smile and get through it and think, Lord, you better blow it. I ain't got a knife. I'm
Yeah,
slit my own
seriously.
throat right now.
It's wild. I mean, but the flip side to that is when you hear people who are qualified to talk about it, and you hear people who do understand the world of cancer very well and how it is getting better, because especially if you compare treatment in the last 20 years to treatment, decades prior, we are getting better and better, even if, the rate of cancer is seemingly, increasing because population is increasing and our exposure to it is increasing. But when you hear Dr. Nemecek and Samira talking about the advancements in care, even if it's not 100% applicable to my individual situation or your individual situation, for me, I always feel good just hearing that, because it means things are coming. It's going to be easier, maybe for myself, maybe not for myself, but specifically for the broad world of cancer, it means that, like, other people won't have to suffer the way I have or you have. And, like, how does that make you feel when they're talking about stuff like that?
I do truly agree that, cancer treatment is evolving. And it has definitely got better than, 15, 20 years ago. Even 10 years ago, that is when one of the real common drugs that's used for breast cancer, Ibrance, was, developed and approved by the FDA to treat breast cancer, was 10 years ago when I was diagnosed. So, you know what I mean? It's just, that was a new drug.
Yep.
And it is. But my only concern and issue with research and the development of new treatments is they need to be inclusive. And being a Black woman, I know that, the clinical trial realm is very clear.
Yeah. Yeah.
There's not very much color to the clinical trials, and that is something that I wish that more people developing the trials would utilize more people of color. So when these drugs are made and released by the FDA, they will really treat the makeup of a community, not just
Yeah. I mean,
aimed at one group. But overall, I love talking to researchers, especially those translational researchers. Finding stuff in a lab and then being able to have it in clinic. You know what I mean? Um, I used to joke when I first started realizing and doing the research around, because I love research. I'd rather do research advocacy than political stuff, because I could hurt somebody easy with political stuff. So
right.
I stay in research, and I always wondered, it's like, jokingly, when you're in the lab and you're working on these new developments or new strain, or trying to figure out why this microenvironment is more, for another. Put a face to your work, because a lot of them don't know a
Right.
patient or haven't talked to an advocate, and then after that ask is that I wish I could get more black mice.
Yeah. I mean, I'm practically
All those white
translucent.
mice running around there. Come on now.
I mean, I can't speak. Like I said, I'm the whitest person I know, so it'd be tough for me. but
Yeah, exactly.
representation, obviously, it's super important in anything. But for something as such high leverage as cancer treatment, it's got to be incredibly frustrating, but also incredibly rewarding when you do see some progress. Which again, not my lived experience, so I can't. I can assume it's very frustrating, but also I hope there is progress being made. And I think that's what conversations like these will yield, because one thing that stands out to me as an advocate, the lived experience I do have is being a young person in cancer, which we talked about earlier. And I just want anyone who's in my situation, and you could then, extend that to people of color, and how that needs to be addressed in these, in research and in representation and the way people are thinking about developing treatment. I want people who are sitting there in my shoes or our shoes to say, okay, I can resonate with that person. That makes me know that someone is out there at least thinking about this and hopefully making progress when I'm too sick to fight for myself, because I think that's what advocacy is all about.
Yeah, I truly agree, because there's oftentimes in my quiet moments and sometimes in my head, I sit back and think, have we moved the needle at all in the past 10 years I've been diagnosed, or the past 7 years I've been in advocacy? Have we moved the needle? And I always say, no, we haven't. But, I think moving the needle is relative. I believe that if I am able to give one nugget of information to a cancer patient that's going through this battle, whether they are new at it or old at it, that helps them in a day-to-day task, that's a win.
Yeah.
So we have to take those wins, no matter how small they may be large to somebody else. So may not have moved the needle too much on the treatment side, but providing information to help other people, it's been a big move.
Well, yeah, and especially in this day and age where we can do stuff like, connect across the country like this and have discussions.
Exactly like this.
Yeah, things are incremental. And, I think that's a good way to head towards a close to this episode. We are doing these things little by little, and it means a lot. So I want to thank you for taking your time to do this, because this is awesome to hear your story. I mean, awesome is relative. Hearing stories is always a little bit heart-wrenching, but it means a lot. And I'm sure the people who see this will appreciate it as well. So Stephanie, thank you for joining us today.
Thank you so much for the opportunity. Anytime.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The opinions of the speakers are their own and do not represent the opinions of organizations they're affiliated with, nor do they reflect the opinions of MantaCares Inc. or MantaCares' sponsors. This episode was supported by an award from the Patient-Centered Outcomes Research Institute.